Hi, my name is Brittany Robertson, and today I will be discussing improving infant and maternal care in India by strengthening the national health systems and global collaboration. Pregnancy and the birth of a child should be a joyous moment in a woman's life, but for many women in India and many women around the world, it is not. As reported by the UN, maternal deaths continue to increase or remain stagnant worldwide, with a woman dying from pregnancy or childbirth every 2 minutes. Maternal deaths have decreased from 309,000 in 2016 to 287,000 in 2020. Reproductive and children's health remains a significant public health issue in many countries, especially in India, which faces an overwhelming burden of maternal, infant, and child deaths. In 2008, it was reported that 1.8 million children less than the age of 5 and mothers had died. 1 million of those deaths were neonates, and 68,000 of those deaths were mothers. Now I like to discuss the origin and causative agents related to maternal and infant health in India. Common causes of maternal and infant mortality are hemorrhaging, infection, risky and unsafe abortions, hypertension, and other factors that contribute to maternal and infant mortality are lack of access to healthcare facilities, inadequate prenatal care, and maternal malnutrition. And to the right, I have a pie pie chart from a study conducted in 2011, and it's basically just showing us what were the leading causes of death, and we can see that hemorrhaging was at 37%, and other disorders which weren't disclosed were at 34%. Now I will discuss the Now I'll discuss the response of national and regional healthcare systems. India's government has taken steps to reduce infant and maternal mortality through the development of initiatives. In 2005, two initiatives were established, the NRHM and the JSY. Through the implementation of these initiatives, India's government was able to increase access to maternal and infant healthcare services, encourage institutionalized delivery, and decrease financial burden faced by pregnant women. Also, funding from the NRHM was used to support um, maternal and infant health uh, in rural and poor communities in India that incorporated local health traditions. Also, um, transportation services were established, and training for labor and delivery was also encouraged. In um, some states governments in India enforce fee for service in the private sector for children's health care among rural and poor populations. Now I will discuss NGOs' role in addressing the infant and maternal crisis in India. The support of NGOs has been instrumental in the efforts to address infant and maternal care in India. Organizations such as Care India, UNICEF have been critical in governing the implementation of community-based programs, awareness campaigns, and establishing supportive services for pregnant women and new mothers. Now I like to discuss a notable program, the Bahar Technical Support Program. Bihar is an overpopulated state within India with over 110 million people. Bihar is also one of the poorest states in the country of India. The state has also been plagued with high maternal, neonatal, and infant mortality rates. But Bihar has and is making notable efforts to save the lives of its mothers and infants through partnerships. The Bihar Technical Support Program is a statewide program that was configured through the partnership of Care India, the Bill and Melinda Gates Foundation, and the government of Bihar. The program's primary purpose is to reduce maternal, infant, and child mortality, to increase access to reproductive healthcare services, and to increase immunization rates. Some outcomes of the program are that the program has established a nursing training program. It uses community workers to connect community members with resources. The program has remodeled primary care facilities into community health care hubs. Public health facilities went from having 39 visits in 2005 to having 10,000 visits in 2018. Also in 2005, there were only 12% of infants who were fully vaccinated, but by 2018, 84% of infants were fully vaccinated. Maternal mortality rates were 312 per 100,000 live births in 2005, but it decreased in 2018 to 208 deaths per 100,000 live births. Infant mortality was 61 deaths out of 1,000 live births in 2005, and it decreased to 38 deaths per 1,000 live births. Now I will discuss the involvement of global health partnerships. Improving maternal and infant health is a high priority for the World Health Organization, the WHO, WHO. Global health organizations such as the WHO or the WHO have collaborated with India's government and other partnerships to assist with the infant and maternal health crisis in India. They have conducted activities such as advocating, promoting, and monitoring. The World Health Organization has also supported and collaborated with UNICEF to launch the network of improving quality of care for maternal, newborn, and child health in 2017. The network for improving quality of care for maternal, newborn, and child health is committed to India's government to ensure that each and every mother, pregnant woman, newborn, and child has access to quality care. The partnership involves evidence-based policy, interventions, and financial support. Now I will discuss my recommendations for strengthening the future response. India has a complex healthcare system of private and public healthcare that supports over 1 billion people. To strengthen India's healthcare system, the following will need to be done. Increase healthcare facilities, because there are a shortage of healthcare facilities in India. Healthcare facilities are also um, poorly maintained, um, and they will need new facilities, and they will need to be taken care of properly. Also, there is limited access to advanced healthcare services, since there is a shortage of healthcare systems. Next, there will be a need to increase and retain healthcare workers. There's a shortage of healthcare providers in India. Limited healthcare providers have an impact on healthcare, and have an impact on the quality and access to healthcare. Um, there is a limited amount of seats in medical school and nursing school. Um, so there would need to be more seats opened up, so India could get more students in their medical school and nursing school. But it's also good that we have programs like the Bahar Technical Support Program, which is providing training for women in the community, providing certified training to women in the community. And then we'll also need to address rural health disparities. There is a limited access to skilled healthcare workers in rural communities, and there's also just limited access to healthcare facilities. And the next would to strengthen the response to infant and maternal healthcare is establishing equitable healthcare costs. High out-of-pocket costs limit access to healthcare, not only in India but all over the world, and the high cost limits women's access to the healthcare that they need during pregnancy. And this is probably another reason why we should lean towards establishing a universal healthcare system. Now I will discuss my recommendations for strengthening the future response of infant and maternal healthcare in India. India has a complex healthcare system that's composed of private and public healthcare, and it supports over 1 billion people. In order to strengthen India's healthcare system for infant and maternal care, I believe we would need to increase healthcare facilities. There is a shortage of healthcare facilities. The healthcare facilities that are available are poorly maintained, and there's also limited access to advanced healthcare services with the facilities that are available. Next, I think finding a way to increase and retain healthcare workers is important. With limited, there's a shortage of healthcare workers in India, and with limited healthcare providers, it impacts the quality of healthcare and the access to healthcare. Um, Maybe a solution to that would be increasing the amount of students that are accepted into India's medical and nursing schools, um, and also maybe replicating other programs um, similar to the Bahar Technical Support Program, which provides certified nurse training for women in the community. Maybe that could be replicated throughout the state, or another program could be developed that provides um, community members with that type of training. Next, addressing rural healthcare disparities. Big thing for uh, individuals living in rural communities is that they have limited access to skilled healthcare providers and limited access to healthcare facilities. So maybe by increasing the seats in medical schools, in the medical and nursing schools in India, and a step and increasing healthcare facilities, we could overcome those disparities that um, are experienced by community members in rural communities. Last, establishing equitable healthcare costs. Um, there are high out-of-pocket costs um, that limit women to accessing healthcare, and by it not being affordable, um, women and children are less likely to receive the healthcare that they need. My final thoughts: improving infant and maternal health in India by strengthening the national health system will require a global collaboration. India's government, NGOs, international organizations, and community partners will have to work together to eliminate barriers to produce healthy outcomes for mothers and babies in India. Thank you for your time. Thank you for listening. And here are my references.